Hi, everyone. This is Dr. Moore with ND Direct Docs again, and I am here today with Dr. April Krowel with the Brain Center out of McCordsville. So a little bit farther from our usual central Indianapolis region, but she does a lot of work with people from Indianapolis as well as virtually. So I want to ask you to tell us a little bit about what you do and why you're a good resource.
Yeah, thanks for having me. Here at the Brain Center, so we are a multidisciplinary practice, actually. So we have a neuropsychologist, myself, and then I have testing psychologists who also do therapy, and then master's level therapists as well. And then we also have students. So it's a multi-level kind of tier system here, but we really want to get the breadth of the population and be able to provide affordable care for mental health services the best that we can. So, and then we also do some cognitive rehab here, as well as, of course, the testing for all sorts of problems, from little kiddos all the way up to older folks and geriatrics. So it's the whole gambit over here. I call it like the comprehensive psychological treatment center.
Okay, I like that. So what kind of diagnoses do people normally come to you, like to get evaluated or to get treatment for?
So I see primarily adults. And so most of the time people come in for ADHD, learning disabilities, the younger folks. And then as we age, we start getting worried about cognitive effects of movement disorders, dementias, and other neurodegenerative processes.
Okay, that makes a lot of sense. You and I were talking a little bit about like a topic that I get questions from a lot from my adult patients, and especially my aging patients. They like to ask me, how do I prevent dementia? Is there anything I can do to keep myself sharp? And I know some of the basics, like use your brain, crossword puzzles, things like that. Use it or lose it. But what do you tell patients?
Yeah, so I tell them, number one, that we can't 100% prevent it.
Okay.
And that's something I'm very transparent, and sometimes those are hard conversations to have. And
Sure.
I imagine that you're probably very transparent as well, just with our conversations. But I usually start with there's no cure. So if you're going to get it, you're going to get it. But we can ward it off and slow down the process as best that we can. So the no-brainers are, of course, using it or losing it. I usually say that about math, but that also works for our brains. So,
Okay.
so definitely using using it for more stimulating activities. So I generally, if someone has more of like the beginnings of, or they're worried, I usually tell them, turn off the TV, do something more stimulating. Our brains tend to kind of shut down when we're just zoned out and watching TV. So that tends to be something no more than a couple hours a day if you're really worried. The other things too are looking at exercise. The nice thing about exercise, and we were just talking about this, is that that no matter how old you are, if you start to exercise more than whatever you're doing now, it's going to help slow down the process. So that's something that I tell people all the time. I'm not going to run a marathon. I'm not going to tell you to run a marathon, but if you just get out and walk, or even just people who don't, we see some low SES here in the clinic. So people who don't have the affordability to get a gym membership, those sorts of things. Walking is free. And even if you just have like soup cans, just be moving your body. And you can be sitting down and doing that too. So it's really just all about blood flow, because the blood needs to flow to your brain for it to operate efficiently.
Okay, that makes sense.
And the other thing is too, is like heart healthy diets, making sure that you're getting, going to the doctors. I know a lot of older folks don't want to go to the doctor. And they don't want to be put on another medicine, and that's not always the case. So just keeping up with those check-ins and making sure that we're healthy otherwise, because that's also going to determine how healthy our brains are.
Okay, that makes a lot of sense. Yeah, I think going to the doctor can sometimes be intimidating for anyone. It's extra intimidating if maybe you aren't getting your words out as quickly as you used to, which is really common, and doesn't necessarily mean you have dementia. It's just something that is very, very common. And in a normal doctor's office, you know, you've got an hour plus in a waiting room and a few minutes with your doctor. And that, I think that can actually make it worse, because then you're anxious that you're taking too long. And now that makes you not get your words out more. And that's one of the things I love about what we've started to do with direct primary care, is that we actually, you know, we run pretty much on time, barring emergencies, very unlikely. And we spend a lot of time with our patients. So if we know someone needs to have that extra time, or heck, even if they'd rather talk on the phone to me, we can do that from their house and then just come in for the exam when they need to. It is really nice because we have those options. I've also found in the time of COVID, of course, many places are restricting visitors or people accompanying them, but because we have such a small practice and we're in charge, we can say, no, of course you can bring your, adult daughter or your wife with you. I'm not going to say, well, maybe no, you have to stay outside. We need to wear a mask, but we can decide how many people can come in for your visit, and we can find ways to make that as safe as possible, which, I don't know, it's very freeing to be able to do that. You do a lot of things with that too, I'm sure, because you have such a need for that family involvement.
Absolutely. That collateral, which is just another word for family, or some trusted adult or person with them, is very, very important. And I almost require it for a memory evaluation.
It's really good to know. Okay.
And if they can't come,
people are sometimes asking me, but can I had a person ask me the other day if they could bring their 5-week-old infant, and I was to their visit, and I was like, well, yes, you have to, you can't leave her at home. So, but people are very worried that they won't be able to have that person with them. And so they're putting off things, I think, that they would otherwise get done.
Absolutely. Yeah. And I like I said, I almost require it. And if they can't come in and with the visit, I definitely follow up with some sort of contact with somebody else, because the worst thing that could happen is you come in and you tell me you have no memory problems, and it clearly is in the data, and then I have zero observational, functioning, data to go off of. So it's like, well, you say you have no memory problems, but the data isn't lying. So, and most people understand that, and there's not usually an issue with getting people in with their loved ones or caregivers or whomever, or trusted neighbor, somebody that has noticed the changes. Yeah.
That is really good to hear. And I know it would be really reassuring to a lot of my patients to hear that. So thank you so much for your time today. We will definitely have to get another conversation going with you, maybe about like caring for patients who have dementia, and ways to help with caregiver stress, how to sort of approach that, because obviously that's another big topic.
Absolutely. Yes. And that can be very stressful in itself. So.
Yes, for sure. So again, thank you for Dr. Krowel. This is Dr. Moore again, and we'll talk to you next time.
Bye.
Bye.